Great. Julie, do you give me permission to record you on my video?
Yes, I do.
Okay. This is my female adult patient. Well-kempt, average weight. We're going to assess your abdomen first. So I'm going to have you bend your legs up like this and just relax. I'm going to inspect the abdomen first. I'm going to auscultate all 4 quadrants. Okay. I'm going to percuss the abdomen. All 4 quadrants. I'm going to percuss for the margins of the liver above the costal margin. Looking for the dullness. And I'm going to measure in between those points to estimate the liver span. I'm going to percuss the mid-axillary line for dullness for the spleen. Okay. I'm going to lightly palpate the abdomen for tenderness. I'm going to palpate a little bit deeper. Again, for tenderness, for masses, pulsations, I'm going to palpate for the aorta. I'm going to assess the width of the aorta, estimate the width of the aorta. Okay. I'm going to check for the liver edge. I'll have you take a deep breath. We'll use the cupping technique. Okay. And while we're here, I'll do the check for Murphy sign. I'll have you take a deep breath. We'll palpate for tenderness, checking for the gallbladder there. I'm going to try to palpate for the spleen. I'm going to palpate for the kidney, the left kidney here, and the right kidney. Okay, we're going to do some special techniques. I'm going to check for McBurney's point, tenderness at McBurney's point, your umbilicus, your iliac crest, this point right here in between, if there's any tenderness there. Looking for appendicitis. We're going to check for Rosving sign. I'm going to palpate the left lower quadrant, checking for tenderness that is actually felt on the right lower quadrant. I will have you relax your legs. We'll check for psoas sign. I'll have you raise this leg up against my hand, checking for tenderness in the abdomen with this, pain in the abdomen with this. I'll have you bend this leg. We'll do the obturator sign. We'll do a little twisting motion like that, checking for, again, pain in the abdomen with that. Okay. Now we're going to check your chest, your thorax. I'm going to be looking for observing for rate, rhythm, quality of your breathing, accessory muscle use, retraction, symmetry. I'm going to palpate for tenderness. I'm going to do some tactile fremitus testing. I'll have you say 99.
99.
Over and over till I tell you to stop.
99. 99.
Good. And now I'm going to do some percussion. Okay, good. I'm going to take a listen to your lungs from the front. So I'll have you take a deep breath each time I place the stethoscope. Good. I'll have you sit up. I'll have your back face me. Okay, I'm going to observe for AP diameter. Again, looking for symmetry in the back. I'm I'm going to palpate again back here, checking for any tenderness. I'm going to do that 99 test again.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. I'm going to check for excursion. I'll have you take a deep breath. Good. Okay. Again, going to percuss back here. Okay. I'm going to take a listen to your lungs. Have you take a deep breath every time I place my stethoscope. And we're going to do a few special testing. I'll have you say E every time I place the stethoscope.
E, 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 E.
Good. Now I'm going to do the same thing, but I'm going to have you say baseball.
Baseball, 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 baseball.
Okay. I'm going to do the same thing one more time, and I'm having you whisper baseball.
Baseball, 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 baseball.
Okay. While I'm back here, I'm going to check for CVA tenderness. I want you to let me know if you feel any pain back here. Okay, checking for pain at the kidneys. I'll have you lay down again. I'll examine your cardiac system. I'm going to take a look at your carotid arteries, looking for pulsations. I'm going to check your jugular vein pressure, looking for the point of oscillation. I'll have your head up 30 degrees. Place the ruler at the sternal angle and measure the JVP from that point of oscillation. Okay, I'm going to take a listen to your carotids for any bruise. I'll have you take a deep breath and hold it. Good. And again. Good. Okay. Palpate your chest for any thrills. Palpate for the point of maximal impulse. Take a listen to your heart sounds for murmurs, with both the diaphragm and the bell. Good. Now I'm going to have you lay a little bit on the left side. And I'll take another listen to your heart from this angle. Okay, and then I'm going to have you sit up. And I'll have you lean forward. You can kind of prop yourself up if that's more comfortable. Maybe turn a little bit this way towards the camera. And I'll have you lean a little bit forward. And I'll have you take a breath, and then on the exhale, hold your breath. And one more time. Good. Okay. I'm going to have you lay back down. I'm going to check your peripheral vascular system. And I'm first going to check your radial pulses. I'm going to assess your arms for symmetry and color and temperature, and then I'm going to check your radial pulse, your brachial pulse. I'm going to check for epitrocular nodes. I'm going to assess your axillary lymph nodes. And again, same thing on the other side. Radial pulse, brachial pulse, epitrocular nodes, axillary nodes, lymph nodes. Okay, I'm going to check your inguinal nodes. I'm going to check your femoral pulse on the right side. Check your popliteal pulse on the right side. Your dorsalis pedis pulse. Posterior tibialis. Your femoral pulse on the left side. Your popliteal pulse. Dorsalis pedis pulse, posterior tibialis pulse. I'm going to make sure your legs are symmetrical. Check for temperature, color, venous pattern. I'm going to then assess for arterial insufficiency with the Allen test. I'll have you make a fist and relax. Good. I'll have you make another fist again and relax. Good. Checking for flushing. Okay, we'll do the other hand. Same thing. I'll have you make a fist and relax. Good. And again. Relax. Good. Okay. And that's it. You're in great health yet again.